Dr. Rachel Rodel at Sanford Health says there is not strong information that shows COVID is severely dangerous to an unborn baby. However, that does not mean infection is harmless.
Some information has noted that there may be an increased risk of preterm birth or early delivery, and an increased risk for the baby to be admitted into a neonatal intensive care unit. There is also some questionable information of whether or not a COVID-19 infection during pregnancy may or may not increase the risk of a stillbirth.
Rodel says expecting moms with severe COVID-19 infection could have more serious complications.
We have seen an increased risk in things like preeclampsia, which is a condition of high blood pressure in pregnancy. And women with this condition have an increased risk for admission into the intensive care unit, needing help breathing and potentially even needing mechanical ventilation on a ventilator, and other life supportive measures like a ventilation method called ECMO, which supports both breathing and circulation, and unfortunately even an increased risk of death.
Rodel says pregnancy is a time where women's immune systems are more suppressed, so COVID can pose a greater threat, a reason pregnant women should get the vaccine.
And we encourage them to get the vaccine at any point in pregnancy, and the sooner the better.
Dr. Rodel says not many women were included in studies for the COVID vaccine, but thousands who received the vaccine before or during pregnancy were monitored and have now delivered their babies.
And through these thousands of women, we have reassuring data that we don't feel that many of the complications we monitor for, like miscarriage, stillbirth, pregnancy complications, are increased with the vaccine. And because of that, the available data demonstrate that from what we know, it's safe in pregnancy, and we encourage women to get it because we're not just weighing getting the vaccine or not. There's that risk for severe infection with COVID.